Hi, good morning. I'm Dr. Madeline Stoops, coming to you from Brighton Animal Clinic this morning. And this little guy is Rocket, my dog, and I'm going to be talking with you this morning about a common problem we see during the holiday season with all the big feasts, and that's pancreatitis. So first I'm going to talk about the pancreas. So the pancreas is an organ that's located here in the crook of the stomach. This is the stomach. The duodenum, which is the first part of the small intestines, and this little guy is the pancreas. The pancreas has two main functions. One is that it produces insulin, and that helps with glucose regulation. The other is that it produces digestive enzymes to help break down food as it enters the small intestines. Pancreatitis is basically inflammation of that organ. And we see that commonly following a high-fat meal. What happens with a high-fat meal is that it induces a mass release of these digestive enzymes. And sometimes when that happens, you get active enzymes leak into the pancreas itself instead of into the small intestines. And that leads to a lot of inflammation. We can also see that inflammation spread not only to the pancreas, but up the common bile duct to the gallbladder and the liver. So, what might you see if your dog has pancreatitis? We will see vomiting, diarrhea, lack of appetite, and often also abdominal pain. Could be general abdominal pain, but specifically right up under the rib cage here on the right side. That's where the pancreas lives. So how do we diagnose it? Diagnosis is based on observation of those clinical signs: the vomiting, the diarrhea, the lack of appetite, the abdominal pain. We can also pick that up using blood testing, specifically testing for pancreatic lipase. When that enzyme is elevated, that's abnormal, and that can be an indication that there's pancreatitis. We may also do some imaging like x-rays or ultrasound, not only to help confirm the pancreatitis, but to help rule out other causes of the symptoms like a foreign body ingestion or other liver gallbladder disease. So the next question is, how do you treat it? Treatment usually requires hospitalization, so the pet has to stay with us. We put in an IV catheter and have them on fluids. The fluid helps to replace their hydration that they lose when they're having the vomiting and the diarrhea. It also helps to improve blood flow, so you get more blood flow to the pancreas, which carries your natural healing mediators, white blood cells and such. We'll also do pain medications, since these guys are painful. We'll do some GI protectants so that they can get their appetite back a little bit quicker. And that treatment usually takes anywhere from 3 days up to a full week for them to recover and get their appetite back. And most pets do make a full recovery, but there are some pets we will see kind of go on to have continued issues, chronic pancreatitis, that will require long-term management with a low-fat diet, being very careful about what kind of treats they get, and that they aren't allowed access to table foods or access to the garbage and things like that. So I hope that you have enjoyed this talk on pancreatitis and that this has helped brighten your day.